Who here would volunteer to get a shot? If you didn't raise your hand, that's more likely the answer I expected. No one here would actually volunteer to get a shot. I mean, who wants to go through pain? As we were younger, I'm sure a lot of us can relate to the fact that we would dread getting shots. So I'm sure volunteering to get the new COVID-19 vaccine kind of seems scary because there's a lot of new information and rushed pressure on the vaccine being made. The COVID-19 pandemic is something that has swept the nation, something that we are all going through still. And the vaccine is still very much controversial, mostly because it was just so rushed when it was made. And a lot of people are arguing, should you get the vaccine or should you not? Now, I am someone who's had coronavirus and has also gotten the vaccine and experienced the symptoms. And so to talk about the controversy of the COVID-19 vaccine is something very interesting to read about. But I believe that the COVID-19 vaccine should be something that everyone should get despite the controversy. So I don't think I feel the need to explain the coronavirus pandemic, but just to give people a little background, the COVID-19 pandemic started all the way back in 2020, and coronavirus has become one of the most viral, contagious, deadly illnesses that science still does not have a complete understanding of. In fact, Harvard Health states emerging research suggests people may be most likely to spread the virus during the first 48 hours when they experience no symptoms. Meaning the coronavirus you could have and not know you have it, and you've just spread it to all your coworkers, all your friends, and all your family, and yet you feel perfectly fine. But then the next thing you know, you have to get tested. Everyone in your work has to get tested. Everyone in your family has to get tested. It spreads really fast. And again, what's scary is that you cannot know that you have it. So you could feel entirely fine while having the disease. Another scary thing about coronavirus is that people who are immunocompromised are the most at risk. Immunocompromised refers to people whose immune system cannot fight off infections. People who fit this category are people with cancer, infants, elderly, and even Johns Hopkins Hospital said that at least 85% or older adults have to get in intensive care units when they contract coronavirus because their immune systems are not able to fight off this infection. And it's really scary that you could pass this disease to a loved one who's older who can't fight it off. There's risk for double pneumonia. There's a lot of cons of getting COVID if you're immunocompromised. So now that we've discussed the history of the pandemic, let's go into a little bit about the vaccine. The vaccine will lessen the risk of getting COVID, which is the obvious purpose for the vaccine to get. And even if you end up contracting the coronavirus, your symptoms will not be as bad if you didn't have the vaccine. And so lessening the spread of the virus and lessening your symptoms, I think, are both pros. We already have social distancing and people wearing masks that are in effect, but people aren't wearing their masks. People aren't social distancing. I think that can only be in effect so much. I don't think people will follow that. And so I think having a vaccine is necessary because not a lot of the population is following the social distancing and the mask wearing. Another thing to consider is that your immunity is strong, but to a certain point. Yes, there are certain vitamins that you can take to make you stronger, like zinc and calcium and stuff like that. Yes, that could make you stronger. But what a vaccine does is that it is already a deactivated virus. In this case, for the COVID vaccine, it's a deactivated coronavirus that is injected into your system, and your body attacks that virus. So that way, you already have antibodies to that virus. And let's say you were to contract coronavirus. then your symptoms obviously would not be as bad because you had that vaccine and your body has already fought off those antibodies. UAB medicine says getting vaccinated creates antibody response. So that way your immune system is already in attack mode even if you get the virus. UAB medicine also says the vaccine will make you less sick. So when you watch the media and you see people that are sick, that is just a small, rare percentage of people who have reactions. But you can have reactions to any medicine. You can have reactions to the flu vaccine. You could have reactions to Tylenol. You have more of a chance of getting hit by a car than getting a blood clot from a vaccine. It's just the way it is. So not only will the shot give you antibodies, strengthen your immunity, again, will lessen the coronavirus, but the shot will also hopefully let this pandemic end sooner. I know everyone's tired of wearing their mask and everyone's tired of social distancing. If we all come together to get this shot and do our research, then we can definitely probably speed up the time of the pandemic and all go back to normal lives. But what exactly is the solution to this? Get your vaccine, get educated, read your sources, read your articles, ask questions, and spread awareness to people. Tell people getting the vaccine is not as bad as they think it is. And always, always, always talk to your doctor. And again, I know people are sick of this coronavirus vaccine, but I think if we all can come together as a community and really just educate each other, we can really, really lessen the spread of the virus. And as this is ending, I really want people to think about, is harming people who are immunocompromised, people who can't fight off this virus, is harming them more important than just getting one little shot and knowing that someone is safe who can't fight off this virus? I want people to leave with that question. Is harming someone more important than taking the opportunity to make our community safe and make the public safe again?